largest change that we saw in response to the One Big Beautiful Bill Act with respect to Medicaid is the institution of a new community engagement requirement or a work requirement. And this is really a fundamental piece that was added in terms of the overall Medicaid program, in terms of where people would need, kind of activities people would need to do in order to actually be eligible to receive Medicaid. Some states, like Georgia, have already had a work requirement as part of Medicaid eligibility, but it hasn't been a universal requirement. It's interesting, if you look at the requirement itself, it's not strictly speaking a work requirement. There is actually some variability with that. There is a requirement that people spend at least 80 hours a month either looking for work or volunteering or being in school. So there is a little bit of flexibility written into the bill. There's also, but there are a lot of unanswered questions in terms of what it will actually look like. A major reason for this goes back to the way Medicaid is organized. And Medicaid is a health insurance program that is duly financed by both the federal government and the state governments. But importantly, it's actually administered by the state governments themselves. And so this gives the states a lot of flexibility in terms of how they actually institute some of these requirements. And that really is written into the legislation. States have a lot of latitude that they're going to explore in the next really 12 to 24 months in terms of what community engagement looks like in their respective states. And so, interestingly, even though One Big Beautiful Bill was passed in the federal Congress, really right now, I would say for Medicaid, a lot of the action's happening at a state level. Mm-hmm. And so this is a really important point that it's state legislators in Richmond and a number of other state capitals right now who are determining what this will actually look like for people in their states.